Good morning, everyone. It's 10 o'clock, so we'll get the session started. Welcome to QI Connect. Thank you for being able to join us for our second session of 2022, and actually our 70th session in this series. For those that don't know me, my name's Jo Matthews. I'm your QI Connect chair for today. I'm delighted to be here. QI Connect provides an opportunity for colleagues across health and social care and beyond to learn from international leaders in the fields of improvement, innovation and integration. So welcome. I'm now going to pass you over to Jess to tell you how it works and how to use the Q&A function to submit your questions for our speaker today, Dr. Amar Shah, of which I'm sure you will have many. Over to Jess.
Thank you, Jo. So just some housekeeping notes before we start. If you could please use the Q&A function to submit your question for the speaker, and I'll just address how that works in a moment. This session will be recorded, and by taking part, you consent to this. In the event of technical issues on our end, if you could please bear with us, and we will work to bring the session back at the earliest opportunity. And a recording of this session and all resources covered will be made available following the session date. So I'm just going to go over to the Q&A function. So on the top right of your screen is the Q&A icon. If you just click on that, that will bring up the Q&A box. You can submit your questions via the Q&A tab. These will need to be moderated, so may take a moment or two to show up in the featured questions. You can also like your favourite questions to make them more visible to the chair if you'd like to see something particularly put to Amar. Thanks. I'll just hand back to Jo now.
Thanks, Jess. So including staff across health and care services in Scotland, we've had 5,378 participants join our sessions from over 27 different countries in the last year. So you can see that significant reach that we've had. And then since QI Connect started, we've engagement with approximately 1,300 organisations, including 89 universities and colleges. Delivering QI Connect is very much a team effort, and what an amazing team that we have. And also I would like to say thanks to the NHS Scotland National Video Conferencing Service who continue to provide us with excellent support for MS Teams Lives, and really we wouldn't be able to do it without them. As with all of our series, we're really keen to ensure that people are able to access the learning, and the quickest way for us to do that is to get that out via Twitter. So please remember to tweet as you learn and use the QI Connect hashtag and Twitter handle, and if you like, give us a follow. So I'm delighted to introduce our guest speaker today, Dr. Amar Shah, who is a consultant forensic psychiatrist and Chief Quality Officer at East London NHS Foundation Trust. He leads at executive level and board level quality, performance, strategy, planning and business intelligence, and has led the approach to quality within East London for the past 10 years. Alongside this, Amar holds a number of improvement roles, including Chair of the Quality Improvement Faculty and the National Improvement Lead for Mental Health at the Royal College of Psychiatrists, where he leads a number of large-scale improvement collaboratives on top of suicide prevention, restrictive practice and sexual safety. An honorary visiting professor at the City of University in London and the University of Leicester, he's completed an executive MBA in healthcare management, a Master's in Mental Health Law and a postgraduate certificate in medical education. Through his work as an improvement advisor and a faculty member for the Institute for Healthcare Improvement, Amar provides improvement support and leadership to many healthcare systems across the world, of which I include Scotland within that, and it's been a privilege and a joy to work with Amar over many years across the quality and safety agenda. Amar has a sizable following on Twitter with almost 8,000 followers and often uses the platform to share the great work of East London Foundation Trust, the work that's happening across Q, and many of the mental health improvement areas that he supports. More recently, I did notice that at the beginning of April that you were starting to read Radical Help by Hilary Cotton, an inspiring book based on a series of experiments giving people the control to improve their own lives and highlighting the importance of building relationships. At the heart of what is outlined in the book human connection, when people feel supported by strong human relationships and where change can happen. Something that connects strongly with what you're planning to share today, supporting the health and well-being of our teams based on evidence around team unity, compassion, joy in work and trauma-informed principles. Many of you in the call today will have seen firsthand the impact of the pandemic has had right across the system. So doing all we can to further support teams is vital. And this discussion today is extremely timely. We're privileged to welcome Amar here today at QI Connect for what I'm sure will be an informative and fascinating session. So over to you, Amar.
Thank you so much for that really kind introduction, Jo. It's a real privilege to be here today with you. I'm Amar. I'm a clinician at heart and an improver in spirit. I still work clinically and lead a clinical team in East London. I've had the privilege of supporting our organisation's improvement journey over many years now, and have also had the opportunity to work across the UK now in my role leading improvement work in mental health through the Royal College of Psychiatrists. And I'm hoping that the topic we've chosen to talk about today is one that will resonate with you. At the heart of health and healthcare is people. The greatest asset that we have in the world of healthcare is our people, and we have all individually and collectively gone through an unpredictable and immense amount of challenge over the last couple of years. So for me, there is probably no more important topic to be thinking about today than how do we support our people and the health and well-being of our teams. For me, improvement work really wraps around teams. Teams are at the heart of how we improve. All care is delivered in teams, and all improvement work happens in a team. So really thinking about how we can support our teams to be as healthy and to thrive and to support their own well-being feels especially important to me right now. Of course, we are living in a world right now where there are multiple challenges facing us and facing our people. The context in which we're trying to do this work is really critical right now. We have, I'm sure you'll realise from your own experience and those you speak to around you, that people are tired. People are extraordinarily tired after 2 years of working inordinately hard. The published studies that we do have suggest relatively high levels of self-reported psychological distress within the healthcare workforce at the moment. People report quite a marked deterioration in their own perception of their mental health, with emotional draining and symptoms of burnout. One Italian study described 45% of healthcare workers describing symptoms of psychological distress. Another study in China showed that 9% of staff were describing PTSD symptoms. And so this high frequency of psychological distress has even been reported in countries where there have been fewer COVID-related deaths. So it's not just related to the mortality of COVID. And it's also not just to do with the volume of work. People have been working extraordinarily hard. People have sacrificed their time off and their downtime over the last 2 years when they might normally be able to reflect and recuperate. It's also because people have been working outside of their usual areas of expertise at times. They've had to work outside the bounds of their normal knowledge and skill. And there's also been moral distress contributing to this. Situations where people have been prevented from providing the quality of care that they feel they normally would want to. And this moral injuries is associated with higher turnover, with burnout and with dissatisfaction in work. So there's a range of reasons why people are feeling tired, and they're expressing greater symptoms of mental illness, emotional draining and burnout right now. But it's also there's a further set of circumstances which are also impacting on the health and well-being of our people and our teams right now. We're seeing an increase in demand for healthcare. The hidden waits, people who have held off from seeing their clinicians and their healthcare providers over the pandemic are now presenting. We've got extraordinarily long waiting lists in areas around the world, close to 7 million in England. Some services, such as children's mental health, are seeing levels of referral that are unprecedented in history and still haven't plateaued continue to rise. On top of that, we're seeing cost of living increasing. I know from just talking to a couple of our district nurses a few weeks ago that people are struggling to even pay the petrol bills now to travel to do the domestic visits that are part of their work. A survey of 3,000 registered nurses just 18 months ago in the UK found that 29% had borrowed money from friends in the last 12 months to pay essential bills, and 11% had actually missed a rent or mortgage payment in the last year. Over a third have described skipping meals in order to feed their family or save money, and that increases when you look at nurses from an ethnic minority. And I've no doubt that that's only got worse over the last 18 months and not better. And on top of that, for those who are living in England, the issue of mandatory vaccination, the topic that caused a lot of stress within the workforce in the run-up to April 2022, has no doubt had an impact as well on the levels of trust between staff and leaders. So there we have a constellation of factors here, complex challenges which are impacting on the health and the well-being of teams, the effects of the last 2 years, and also now the continuing effects of demand and large numbers of people waiting to be seen, which creates this sense of inexorability, facing a wave coming towards you that doesn't seem to be abating. And the basics of just being able to survive and live comfortably, being able to afford food and fuel, seem to be that much harder these days, and it's probably only going to get worse in the coming months and years. So for that reason, I think it's important for us to consider as leaders and people working in teams in healthcare, how can we help? How can we really support our teams to thrive within this kind of complex and unpredictable and difficult environment? And I want to sort of preface what I'm going to say today by saying that nothing I'm presenting today is new. There's nothing earth-shattering in what I'm going to present to you, because I think really the most important thing for us to be focusing on is just coming back to the basics, really coming back to what we know is important in enabling people to thrive in the workplace. So I'm going to try to distill down what we know as some of the key areas of evidence around in this field. Because it is a large field and there's lots of places we can draw on, but I'm going to try to bring together what I think are some of the most important evidence-based frameworks, and then think, how might we use that in practice? How could we create something simple enough that all of us can go back to our teams and start to try out some ideas to help us understand better how to support our team to create well-being, work in a way that enhances joy, create healthy, thriving places where people can do the best that they possibly can in the workplace. And I think there is an ask in this about just keeping it simple and creating a framework that's actionable. So that's what I'm going to try to do over the course of this presentation. And I'm going to start with something that probably many of you have seen and heard and read about before. And this comes from Abraham Maslow, a psychologist who created the hierarchy of needs that you see on the screen here. He's a psychologist who believed that people's motivations were based on seeking fulfillment and change through individual growth. So he created this 5-tier pyramid, which is known as Maslow's hierarchy of needs. And it's usually divided into 2 groups. The first 4 are deficiency needs and the 5th is the growth need. And Maslow's theory was that people can move up the hierarchy, but they need to be satisfied with the lowest tiers first in order to move up. So the lowest tier here, the most fundamental tier in Maslow's hierarchy, is the physiological needs. And often we sometimes feel like these are almost assumed, but actually I think in today's world we need to be paying attention to these basic requirements for survival of food, of water, of warmth, of sleep. And almost the essentials just without which the human body can't function properly. So I think there is a case for us coming right back to the absolute fundamentals from Maslow around ensuring that we as individuals and those around us really pay attention to the basic requirements of survival, the physiological needs, some of which are getting harder and harder. If you think about our gas bills, at home, or our petrol bills to travel around for work. Those are getting much harder to be able to afford now, and to be able to balance with the other things we want to be able to do in life. Once we've thought about physiological needs and we've satisfied those, the next tier up is safety. And obviously safety has been a predominant consideration over the last 2 years, really trying to make sure we keep our people safe, physically safe with PPE and other forms of infection control, but also psychologically safe too. And I think there's a real importance here in making sure that people feel like they are working in an environment that supports their own safety and security, and that we're meeting those needs through financial security, stability, and emotional security. Only once we've met physiological and safety needs can we then think about love and belonging. And I think there's a case to be made that belonging, feeling like we belong, is something that may have been frayed and impacted by some of the changes to the ways in which we work today, with much more virtual working or hybrid working through Teams, through digital communication. There is sometimes the loss of that personal nature, that connection, the intimacy of working alongside someone else, that we need to probably pay attention to and think, how do we bring that back into the way in which we interact with each other and the spaces in which we work together, whether they're physical or virtual. And then Maslow went on to describe esteem needs, thinking about how we might acknowledge achievements and independence and dignity and the desire for respect and reputation. And then finally thinking about the highest level of need, which is self-actualization, becoming the best that we possibly can be. So from Maslow, I want to move on to another really important framework developed back in the 1960s from Frederick Herzberg, who was a behavioral scientist thinking about motivation. And he, through a series of experiments he proposed this two-factor model that I think is really important for us to keep in mind too. Herzberg proposed that there are two different types of factors that contribute to our satisfaction in the workplace. There are hygiene factors, which are important in making sure that we are not dissatisfied with our job. These are essential for the existence of motivation. They don't lead to positive satisfaction, but if they aren't there, we will be dissatisfied. And these are things to do with our working conditions, our pay, the policies and rules at work, the supervision we get, those essentials that we need to make sure we have in place. But Herzberg then went on to say that there are other factors, motivational factors, which can actually yield positive satisfaction. So if these are absent, we don't get dissatisfaction, but we aren't able to achieve true satisfaction in our workplace. And these are things to do with recognition, giving people responsibility, celebrating people's achievement, making sure there is personal development and growth. So I think we need to again keep in mind that we're paying as much attention to the hygiene factors and the motivational factors, because we need to be doing both, not one or the other. The third area of evidence base that I think is really important for us to keep in mind now when we're thinking about team health and well-being, and it might not be an obvious one for people to straight away go to, is the science around demand and capacity. I've illustrated this here with a bathtub, but it can sometimes feel like the tap is on and the bath is overflowing and we don't know how to stem the flow. And when you're working in an environment where the tap is just on at a rate that we're just not able to manage, it can create a real sense of powerlessness, and we can lose all autonomy over the way in which we work and the system within which we work. So actually there is a science to managing demand and capacity and thinking about how we respond to high levels of demand that we need to bring to bear. There's an evidence base and a science to this, and we need to really watch for just going to the same old solutions we've tried in the past, doing more of the same. Simply asking for more resource or working harder isn't going to be the answer here when we're looking at levels of demand that are much higher than we've experienced before. We need to really do this systematically with the science and bringing our creativity around what can we do differently. How can we really think about managing demand upstream, trying new ideas to prevent people from needing to seek help and support and actually manage it in more creative ways and use other kinds of assets in the communities beyond just the healthcare system. So we need to really think about what is the capacity we have, And your capacity is not fixed. You might have a fixed resource, but your capacity can definitely be flexed if you change your service model. We need to think about what the backlogs are, what are the queues, and where do they exist, and how can we really think about addressing those, and what are the activities in the process, and how can we really strip out the less value-adding steps in our process, so that the science and evidence base around demand and capacity and flow feels really important for us to bring to our teams right now. And this is true even for teams that are not clinical. Many non-clinical teams, those who are managing assurance processes, managing safety incident processes, complaints, freedom of information requests, a number of those teams equally have high levels of demand over the last 2 years and have backlogs and queues now. And this science is just as important for them to feel like they can keep some control over their environment, be able to have a plan that will help them address this over a period of time, rather than simply feeling like they have to work harder. The next area of evidence that I want to just draw on comes primarily from the work of Professor Michael West and his team, who Michael's done a huge amount of work learning about teams and compassion, and much of that is really critical right now. A couple of years ago, Michael West and Susie Bailey published The Courage of Compassion, and I'd recommend you have a look at that if you haven't already, because I think it describes a wonderful, simple framework that all of us can apply in the workplace, the ABC, thinking about 3 core work needs that need to be met in order to ensure the well-being and flourishing of people at work. Autonomy, the need to have some control over our work and to be able to act consistently with our work and life values. The last 2 years has often meant that we have flipped from being proactive to being much more reactive to the situation around us, being told what to do, going back into command and control mode. We need to pivot back to being more proactive now, devolving decisions to our teams, really reinforcing that they have more control, that they have some control, that they can regain control over the way in which they work, the environment within which they find themselves, and the situations they're having to work through in their daily lives. The second is around belonging, the need to be connected to others, to be cared for by others, to be caring of others, to feel valued, respected and supported. And in a world that's been fast-paced, where we've switched to much more virtual working and hybrid working, I think we need to really come back to the importance of belonging, making sure that we create time to connect as humans and spend time together socially, recreate those water cooler moments, bring back what Steve Svensson described as commensality, eating together socially, creating those bonds and relationships that are so critical to effective functioning, engagement in the work, and really feeling like we belong to our team and the purpose of the team. The third is the C, the contribution, the need to be able to experience that we're effective in what we do and that we're able to improve outcomes for the people that we serve, making a positive difference, being able to influence the world in which we work in for the better, and being able to focus on what really matters for the people we serve. This feels like a real opportunity for us to be coming back to some of what we've learned over decades now around giving people the skills, the space, the support to be able to actually focus on what really matters to the team and to the patients they serve, and problem solving, and making sure that people can come up with their own creative ideas and be able to test those out and use quality improvement to make things better. That sense of contributing, that sense of being able to have some ownership over what we want to improve and be able to make a difference and actually be able to change what can sometimes feel like an impossible, complex environment in which we work in is really important. And actually, we've seen the relationship between people being able to contribute, feeling like they can contribute, being able to improve the system, and their experience at work through quantitative studies such as the annual staff survey in the National Health Service. The next piece of evidence base that I think is really important for us to keep in mind is the work done by the Institute for Healthcare Improvement on their Joy in Work framework. You may have come across this before, the Joy in Work wheel on the left, which has 9 components. 3 of those are things that we as individuals need to be keeping in mind for our own joy, things like being able to make changes and test ideas day to day, being able to focus on our own well-being and be able to measure how we feel. Two areas which are in the gift of team managers and leaders, really making sure we're involving people in decision making, and enhancing teamwork and finding ways to promote camaraderie within the work. And then 4 areas which are really for senior leaders to pay attention to: recognizing and rewarding people's contributions, reinforcing that people have autonomy and control over their work, making sure people stay connected to why this work matters, the meaning and purpose behind their work, and creating conditions of physical and psychological safety. This evidence base is a really succinct and rich source of ideas if we're looking to create a joyful, engaged workforce. And finally, the last piece of evidence that I wanted to just summarize and bring to you today was around the use of trauma-informed care and trauma-informed principles. Much of this has now been integrated into the way that we deliver clinical care in some settings, but actually I think applies just as much to the way we work with each other and our teams. Health and care staff have put themselves in harm's way over the last few years. People have had to work beyond their area of competence and experience at times. We've experienced moral injury. We've had to make difficult decisions and choices that are sometimes at conflict with our own internal values. We've probably all experienced loss and illness within colleagues and family. All of this constitutes potential trauma. And trauma is a response to a stressful, frightening or distressing event. And so I think there's merit in us thinking about how do we apply our learning and evidence base around becoming trauma informed to the way in which we relate to each other at work and the way in which we support and lead our teams. Being trauma informed means, realizing the presence, recognizing that the presence and impact of trauma, recognizing the signs and symptoms of that in those we work with, and responding to this in the way that we work with and support our people, and making sure that we avoid re-traumatizing people. Some of what people have gone through will amount to stress, and some of it will tip into trauma. But there's definitely some learning around, how do we create the safety where people can talk about what they've gone through and feel safe enough to do that and bring their concerns to work, where people feel like they have choice and control over what they do in the workplace, collaborating with people, making decisions and sharing ownership of decision making, being trustworthy, being really clear about boundaries and consistency and clarity of work, and empowering people. Those really important principles around trauma-informed practice, I think, are just as valid and useful in the way that we think about supporting our teams. So in bringing that all together, I've tried to distill what I think are some of the most important areas where I would be paying attention to the teams that I work within and lead. And I think probably the first place I would start is in bringing the team together to just come back to this question of what are we here for? What's our purpose? And how do we all contribute to that? And what impact does it have on those we serve? And how do other people recognize our contribution? I think that coming back to purpose is an important exercise for us to do in our teams now, partly because 2 years of working very differently may have led to siloed working, may have led to a team that was previously quite well connected around purpose to lose some of that strength in purpose. But also changes in ways of working mean that we have to probably regroup around purpose even more. I think also need to find and create safe spaces where we enable people to reflect on their own experience and be able to share what they're grappling with in their world right now. I think we need to find opportunities to connect again in person and find ways to rebuild some of the camaraderie, the fun, the joy that comes from working alongside each other and with each other in a common cause. We need to really make sure we're getting the absolute basics and essentials right. It's those little things that can sometimes cumulatively cause people to have a poor experience at work, and actually they're often things that we can actually do something about. We need to be listening to what really matters to the people we are working with, and I think we need to come back to our learning around the difference that improvement can make as a philosophy, as a way of thinking and being, and as a method to help us solve problems, helping us pivot back from being reactive to what others tell us to do and what the situation demands of us, to actually taking more control over it, recognizing what we need to work on and devolving power to our teams to be able to try out some ideas to make a difference. I think the other interesting thing to watch has been in countries and organizations and teams around the world, you know, where have people really been focusing their efforts around health and well-being? I think there's a temptation to look for big shiny things, to come up with attention grabbing innovations which can be deployed at scale, often at whole system level or whole country level, or whole organization level. Whereas I think, you know, my theory is that there's much more utility in thinking about health and well-being at the team level. And I see fewer systems, countries, organizations really designing their approach to health and well-being around teams. And yet we spend most of our time working within our team closely with the people, you know, in our team. It probably has the greatest impact on our daily experiences is the interaction we have with those around us on a day-to-day basis. And so I think the biggest impact we could possibly have on health and well-being is probably going to come through interventions that are designed at the team level. So here's what I wanted to offer to you today is a simple framework that I think you know I might offer out to you to go out and test in your team. And there are bits in here probably that will resonate and bits that will resonate less. So I'd be really keen to hear, you know, where you think you might want to pay some attention, try out some ideas and see whether there's some useful work to do within your team. I would start with the what I've called here the essentials, making sure we have enough people. Even before COVID, our health and care workforce was struggling to cope. There were more than 100,000 staff vacancies in the NHS in England. So that's 1 in 11 of all posts. And you know, if you look at Northern Ireland, it's 7,500 vacancies, which is 1 in 8 of all posts. That's staggering. Turnover is high, and I think coming out of a pandemic, I think turnover will be even higher. More than a quarter of midwives and nurses say that they're considering leaving the organisation they work in. And I think since COVID, that's probably gone up to around a third. So we need to really make sure we have and we're recruiting people into our teams and trying to be creative about the way we do that, making sure that our recruitment processes are as slick and as lean as they possibly can be, and that we're creative in thinking about what kind of roles we need and how we can also utilise different assets in the community beyond just looking at health and care staff. We, as I've said before, need to really make sure that we have an understanding of how best to manage the demand that we're facing and use the science of improvement to help us with that, being creative, being systematic, and that will give our teams some sense of control, that they do have a plan to manage what can sometimes feel like an inexorable wave of demand coming their way that never seems to cease. And I think we need to make sure people have got the basic stuff to just work effectively. The equipment, the support around them, the infrastructure, the environment. These are sometimes things that are in the gift of leaders to help solve and make better, and actually it can make a big difference to people's day-to-day experience at work. I think we need to then think, how do we remove the pebbles in people's shoes, the little things that just impact on people's experience day to day. And I think one high impact thing we can do is just ask the question, what would make a difference, and then respond. I was really taken by a story I heard last month from someone who went to a community team and simply asked this question: what would make a difference for you to be able to work better and be able to have a better experience at work? And over 50 ideas came back from that relatively small team. And most of those ideas were things that the leadership could actually provide. Things like, you know, better headphones, as a really simple, tangible thing that would actually make a difference for people. A relatively small thing, but something that would actually make a difference. But the important thing is to listen and then to respond. I think there's an opportunity for us to cut out waste and really enable people to focus on what matters most. Sometimes the virtual working world means that we have crammed our diary full of virtual meetings, often unnecessary ones, things that could be done outside of a meeting. So let's really try to understand where do we add most value, and how can we remove things that add less value for us. And I think we need to pay attention to reconnecting, making sure people have time away from work on a regular basis, to connect together, to reflect together, to plan together, to have fun together, to eat together, all those essentials of healthy, thriving teams. And I would double down on away days at the moment, and really make sure that every team has an away day on a frequent basis, to just focus on connection. And I would do most of that in person if you possibly can. And for teams that are working in a hybrid way, sometimes virtually, sometimes together, or even teams that are working entirely virtually, I would now be starting to carve out regular time together in person, because there isn't really any substitute for in-person time for the social elements, the connection, the relationship building, the fun, the camaraderie that we need for effective team working. And as I mentioned before, I would be revisiting our purpose as a team. And then finally, I would be thinking about how do we support people to contribute to making things better. And here I think we have a role, those who are in leadership positions have a role in making sure that we create the conditions of psychological safety so that people can speak up about the things that work and the things that don't work in the workplace, and they can test out ideas to make life better for everyone. And then I think we can start to be deploying quality improvement, and enabling people to really own the challenges they're facing, to come up with their own ideas, and to feel empowered to be able to try out new ideas to make a difference. Final thing I would suggest is, we probably need a way to answer this question: how would we know how our team is and that things are getting better over time? I see quite a lot of focus on large surveys of staff, often across an entire workforce or a region or a country, at relatively infrequent time periods, maybe every quarter. And I think we need to really understand variation on a much more frequent basis than this, and actually probably own this within the team rather than feel like it's something we're doing for somebody else. So I would keep the measurement simple. I would do it much more frequently. There's so many digital platforms now we can use. Pick something that you feel is useful to measure it regularly, maybe every week. Keep it simple, but share the data openly and transparently so everybody can see it and they can see what they're contributing to, and that can spark some conversation. Have a huddle around it. Find out, why did we see a slightly better score last week than this week? What did we do differently, and how can we do more of that? And importantly, take action. Come up with ideas from the team and actually test them out. Here's an example of a team that's doing just that, and I think this is the sort of thing that we should all be aspiring to, is really capturing data frequently, sharing it transparently, being able to look at the variation in best practice ways so we can pay attention when things are starting to demonstrate that things are getting better or getting worse in a way that we need to be paying attention to and acting on. And you can see the sort of conversations that this sort of data might trigger in a team. And there are signs of positivity and optimism for us all in this work. I'll just take one example of this, and it's work that we've been doing through the Royal College of Psychiatrists over the last year, a year-long programme in the midst of COVID, to really enable around 40 teams who are taking part to really work on the well-being of people in the team and create the conditions for joy in work. And we've adopted the model for improvement as our improvement method here, and created a theory of change that you can see on screen, and supported these 40 teams to be able to come up with their own ideas, to understand what contributes to people feeling healthy, feeling a sense of well-being and joy in their work, and be able to try out their ideas. And the results are showing that this is making a difference. The program comes to an end next month, but we're already starting to see improvement in our outcome measures, in the percentage of people who are enjoying being at work frequently. This is the most extreme of the 5 options on the scale. So frequently enjoying being at work is seeing a 44% improvement. Of those that are enjoying being at work fairly often or frequently, there's also an improvement. And then on our other outcome measure around burnout, we're seeing an increase in the percentage of people who experience absolutely no symptoms, who describe no symptoms of burnout. This is from the Maslows burnout inventory, the single question item around burnout. So this again is the extreme response on that scale of no symptoms of burnout, 42% increase in people who are experiencing no symptoms of burnout. So I think there is an increasing evidence base that if we apply the principles here, the evidence base, and give power back to our teams to be able to own this, to really come up with their own ideas based on their local experience and their wisdom around what makes a difference, and try those things out, it can make a difference. So I'll leave you with this this framework, which I hope is simple enough, brings together a range of different types of evidence into something that I hope is simple enough that you can take back to your team and think, right, where in here might we want to focus our attention? Where could we do some work? Where might we want to try some ideas? And then come up with a way to measure so you can see whether it's making a difference. Thanks very much, Joe. That's what I want to share, and I'm hoping that's triggered a few questions in the audience that we can now have a conversation about.
Thank you so much, Amar. Loads to think about there, and whilst I appreciate you called out that there was nothing new in what you've been describing this morning, but coming back to those basics and refreshing what we already know and thinking about those tangible tools and approaches, it's incredibly helpful in this current context, especially where there are people that are feeling really overwhelmed and actually starting to think about, where could I even start with this? So really, really thought-provoking. Before we start our Q&A session, I'd like to introduce our guest speaker this morning, Des Brown, who is the programme lead for QLab Cymru and Public Health Wales. So over to Des for the first question.
Thanks, Joe, and good morning, Amar. So just touching on some of the things that you mentioned, my question is, how might we design organisations which sustainably nurture better health and well-being of our staff and teams?
Thanks, Des. That's the ambition, isn't it? To design a system that puts well-being and health of our people right at the heart of it. I think it starts with making sure that health of our teams and the well-being of our people is a strategic priority for us, and that we recognise the causal link between people's experience at work, their well-being, and the outcomes of the people that we're serving. It's not a choice really from me. We have to do both, and making sure that the health and well-being of our people and our teams gets as much of strategic priority as focusing on the outcomes and experience of the people that we serve in our local communities, I think is the first step. I think the second is to really make sure that our mental model about this is akin to the way in which we would think about improvement. So we need to move away from, I think, large organisation-wide programs around this, and really wrap this work around the interactions that people have on a day-to-day basis with the people they work alongside, which is their teams, and really start to design organisations that make sure that teams have what they need to be able to thrive. Not that the organisation provides programs and support that people have to call on, but actually that every team has around it what it needs. And that's often very different to the way in which we're designed now. I mean, most healthcare around the world is designed for a command and control environment. It's pyramidal structures, which are really good. They've served us well in the last 2 years, conveying information up and down the chain, but they're not great at really enabling teams to thrive and innovate and improve autonomously. And we almost need to create what Kotta described as that secondary operating environment now, where teams have everything they need around them to be able to thrive and be able to design their work in a way that makes sure that well-being of their people is at the heart. So for me, that needs a very different approach and mental model, but it comes, I think, starts from making this a strategic priority and making sure that we recognise that the answer to this is not going to be in shiny programs that we offer trust-wide, but actually the much harder work of enabling every single team in the organisation to start to own this and lead this themselves with the right support around them.
Thank you very much for that. And we're going to move on now to some questions. So, and there's a number in the chat box. So I'm going to start off with the top liked question, which is around the political discourse has shifted from clap for carers on a Thursday evening, which I'm sure we all remember, to that more confrontational political environment, such as the anger over backlog of waiting lists. So how can we help to provide that appropriate shelter for those staff which reflect wellness and resilience?
Yeah, that's a really interesting question and an observation about the environment in which we're working right now, and I think it was in some ways almost inevitable and predictable. I think there's a really important role for leadership here in making sure that our teams and our people have the security within which they can actually tackle these really immense challenges without feeling the pressure from outside. And it's our job as leaders to almost put the umbrella up and be able to shield our teams and give them the space they need to innovate. If we simply cascade stress and pressure through into our organization and we just allow it to filter through, we're doing our teams a disservice. So we need to hold on to our principles, our really core principles around how do we want to solve these problems. And the answer to this has to be to co-produce the solutions with the people who are most involved and impacted by it. That's the patients themselves with the staff at the point of care. And it's got to be to innovate. It's got to be to apply our different creative, innovative ideas to help solve these challenges. And that needs time and it needs space. And so we need to make sure that we are managing expectations, but they're also, we're telling stories of how things are improving. It's not enough to say, well, we'll get there in 2 years' time. Actually, you know, even now with the 50 teams we have in East London Foundation Trust who are managing really long waiting lists and high demand, all of whom are applying quality improvement to that and being creative. There are stories that we can tell month on month to show that we're making headway, that we're trying new ideas, we're being innovative, and that we're doing that in as co-produced a way as we possibly can. So I think this is partly an ask of leadership to provide that space and that sense of safety where people do feel like they can try new ideas, because otherwise we'll end up with a situation where we feel like we just have to work harder, and that would be the worst of all situations. It would only create an even more depleted workforce for us.
Yeah, and that links to sort of two further questions that we actually have in the chat box. The first one around how any tips for thinking about how we support bringing managers on board and being able to support those teams, because sometimes they're in a challenging position as well.
They are. It's probably the hardest position to be in, to be honest, is the role of sort of leading a team or managing teams. It's you sort of feel it both ways, don't you? You're so close to hearing and experiencing what your staff are going through, yeah. And you're also having to balance that with what you're hearing come from the leadership in the organisation and having to meet multiple priorities. I think hopefully what I've presented today is something simple enough that those people who are in management roles can say, you know, this is something that I might want to go away and do with my team. It's a framework that gives you permission to actually tackle the things that really matter. They're literally going and listening and asking questions about what can I do to make your day-to-day better. It might feel like a slightly banal thing to be asking as a manager because that's your job probably, but actually sometimes if you don't take the time to ask that simple open question, you won't know what you're expecting to hear back. And so sometimes just going back to the absolute basics of being visible, being alongside your team, really finding those spaces to ask open questions, listening and then responding, figuring out what can I do to make your life better. And that sometimes needs the manager. You're in a position of formal power to be able to do certain things like remove some meetings, change the way you work, make some of the bureaucracy in the work simpler, allow your team to come up with ideas about how they can work better together. You're in a position where you actually can influence quite a lot. So I think it's a privileged position to be in, where actually you can really look at the culture and climate within the team, hear what people are experiencing, and actually see what you can do something about. You won't be able to influence everything that comes up, and that's the nature of the world we work in. You know, most of us are impacted by what's happening in Ukraine at the moment, but we can't do much about it. We're all impacted by the cost of fuel, but we can't do much about that either. But there are things that we can do something about, and that's where we need to be focusing our attention. Where can I influence? What are the assets and strengths that we do have within our team? And let's really focus our effort on making the most of those strengths that we have.
And it comes back to that point that you're mentioning about managing expectations. And one of the questions is actually how do we manage expectations when we ask what matters, when actually some of those pebbles actually might be big rocks, such as parking, hot food 24/7, and being able to be in that position to influence up the way, but also manage expectations. So that's incredibly challenging for managers as well as the staff who are experiencing it as well.
Absolutely. And I think we need to do both as a manager. We need to sort of figure out, what do I have some influence and control over that I can actually take ownership of? And then what are the really big boulders, not the small pebbles in the shoe, but the big boulders, the things that I'm alone not going to be able to solve, and where I actually probably need to find a wolf pack, a team, allies, people who will join with me in advocating for this change. And how do I make the case to senior leaders about this? So you probably need to think, how do I do both? And I think both can be a source of energy for managers and leaders if we see it as an opportunity and not as a problem.
And coming back to the compassionate leadership and thinking about those ABCs, you mentioned within that about belonging, and particularly in this context that we have been working in, from virtual now moving to more of a hybrid space. Many people have continued to work day to day with their teams, but actually getting back to that informal water cooler moment, and how do we support teams in particularly in that virtual space and the hybrid space to really get that sense of belonging? Have you got any tips for people?
It's a tricky one, isn't it? It's an area where we're all going to have to innovate and try new things, and I bet there's some really good practice out there that we could go and find and learn from. I think we just have to watch for the tendency to fill our day with virtual meetings and think that means we're being productive. We're probably not being productive, we're just filling our time. And actually we also need to watch for just how easy it is to invite people to things. And then people just end up joining meeting after meeting after meeting and not feeling like they're actually adding value or contributing or doing the things that really matter to them. So we need to the first thing to do, I think, is to create the space for it. Make sure people have enough time to actually do their work, and really ask ourselves the question of, do I need a meeting or a call about this, or can I pick up the phone and speak to someone, or how often should we be together, physically together, and what could we do together that's different, making use of in-person time in a very different way so that it really feels value adding, so that we're focusing on less work stuff, which you could probably do in other ways, and more social stuff and more innovation, the things that really benefit from being in person. But there's probably a whole load of really good ideas around how we can keep the personal connection, keep the spontaneity, even when working virtually. But I would always make sure that the team owns those decisions. What do they think is going to work best for them? And I bet you every team will be slightly different, because some will have different preferences, they'll have different things that they feel might work best for them. And I really would be cautious about trying to create some standardization for this. I think every team probably has to work out for themselves what their right rhythm is, what the right channels are for them, what their right sort of frequency is of in-person and virtual working.
Thank you. And lastly, a question in relation to, you place focus and real importance on bringing teams together again, and particularly around away days. And I know there are many people thinking about this moment in time. What do you think actually makes a good away day? What would be the ingredients in it for you?
I've been to a lot of away days in the last 3 months, intentionally. And I think when I look back on them, the thing that I always judge as to whether this away day was really beneficial was how many times did I see people smiling and laughing during the day, and how many stories did people share that are not work related with each other. I've learned so much about people that I would never have done if we'd not met in person. And I've had so many laughs that we wouldn't have had if we'd not been in person. So away days ought to be a place where people can feel safe together, they can share together, they can reflect. A lot of teams haven't had space to even process what they've gone through and think about what it means for them and the future of their team. Think about how they want to work together. And then I think we need to create spaces that are just a bit more lighthearted, like allow people to just eat together, spend time together without agenda, and have some fun again. And I think there's probably nothing more important we can do than just allow people to have that space for fun and laughter, and to connect together socially again.
Really, really important, and so many messages there which I'm sure will have resonance with many of the people on the call today. Thank you so much, Amar, for your thoughts and reflections. Incredibly powerful. I really appreciate your time this morning, and thank you to everybody who posed questions. There was many of which we've not been able to get through all of them, but I hope it's given you a flavour and further insight into the thinking in this really, really important area. So if we move to the next slide, please. So I'd like to introduce our next speaker, who will be coming along to join us on the 2nd of June. And that is Becky Margiotta from the Billions Institute. We're delighted to have Becky along. It promises to be another insightful and thought-provoking session. I've been lucky enough myself to recently spend 3 days with Becky through her work around spread and scale, and I can really recommend hearing her story and her reflections. So if you're able to register for that event, the link will be coming out shortly, and we'd be really delighted to have you along. Just to remind you, and of course, the rest of our back catalogue, all of those sessions that we've had are available for you to watch and enjoy on our website. But you can also visit the QI Connect YouTube channel. I'd like to take this opportunity to say thank you very much for everybody joining us today and taking time out. What I appreciate will be a very busy time for people, and hopefully we will see you again very soon in June. Thank you very much.